My name is Sanait Fakado from WHO Regional Office for Africa. I'm the Technical Officer for Emergency Operations Center. I will be moderating today's webinar. And I'm joined by presenters from Saudi Arabia, Dr. Jamil Tala Abdul Nen and Dr. Hisham and we are also waiting for Dr. Sharif from Cote d'Ivoire. And panelists, Catherine from USCDC and Osman from WHO EMRO. So thank you for joining the 42nd webinar of our weekly webinar series. Just a very quick reminder, translation services are available. Please click on the button at the bottom of your screen to access the translation services. Please also place your questions in the link in the Q&A box, and we'll address them during the Q&A session. So our today's topic, we're going to get countries sharing experience on implementation of IMS. As you all know, we've covered the different sections of the incident management system in the past few weeks. Today, we're going to get experience from countries. We have presentations from two countries, Saudi Arabia and Cote d'Ivoire. So our first speaker is Dr. Jamil Talal and Dr. Hisham from Saudi Arabia. Dr. Jamal Talal is the General Supervisor of the Emergencies, Disasters, and Medical Transportation. He is also the Director General of the National Health Emergency Operations Center. And the second speaker is Dr. Hisham Ali Dinar. He is disaster medicine, disaster management specialist. He is advisor of the Director General of the General Directorate of Emergencies, Disasters, and Ambulance Services. He has been part of the team establishing the National Command and Control Center in National Situation Room in response to MERS-CoV outbreaks in 2014 to 2019. He was also part of the National Health Emergency Operations Center project team and as professional is professional on key performance indicator and data visualization, and he leads the EOC dashboard in data analytics. So they are going to experience to share their experience on the planning section of the incident management system. Over to you, colleagues from Saudi Arabia. Do we have Dr. Okay, maybe we give the floor to Dr. Hisham to proceed with the presentation. Over to you, Dr. Hisham.
Thank you very much. Assalamu alaikum. Bismillah, alhamdulillah, thank you very much. Good afternoon and good evening for everyone. My name is Dr. Hisham Ali Dinar. On behalf of Dr. Jamil, the General Director of Emergencies, Disaster and Medical Transportation, I will talk about the country experience in the planning section. Unfortunately, Dr. Jamil committed now in a quick meeting with His Excellency, the Minister. So I will cover his part and my part at the same time. So I would like to confirm if everyone can see my screen at the moment.
Yes, we can see it.
Perfect. At the beginning, I would like to thank you for giving us the opportunity to participate. A quick question regarding the time, just to confirm how many time do we have for the presentation?
Yeah. Sanait, I think you have 20 minutes, Dr. Hisham. So
Perfect.
Go ahead, please.
Perfect. Thank you very much. So, so I'll start by a quick introduction about the Kingdom of Saudi Arabia. Now, within the country, we have 3 administrative regions that's distributed through 5 big clusters: the North, South, Middle, East, and West. The health system, though, is divided into 20 regional directorates that's being distributed through the 13 administrative region. Now, the National Health Emergency Operations Center is the responsible of managing all aspects related to health disasters. Now, the National Health Emergency Operations Center is linked to the 20 regional EOCs, and the basic concept and mandate of the National Health Emergency Operations Center is to cover all elements related to emergency and disaster management through a specific mission is to be the emergency management unit covering all national emergencies, adopting the all hazards approach, emergency preparedness and response. This will be fulfilled through different objectives and activity that range from the preparedness, the surveillance, mitigation, and response, and of course the recovery. And to fulfill that, the National Health Emergency Operations Center has built an effective collaboration with local units and facilities that extends from the healthcare facilities and other interministerial bodies relevant to the National Health Emergency Operations Center. So there are 3 operational modes for the EOC, which the routine part, routine work, which is level 1, where we manage the routine day-to-day work, and the partial activation of the EOC, where we activate partially the incident management system, and the fully activation of the EOC, where we activate the whole function within the EOC. And those are the response level in the country maps towards the NHEOC activation levels, where we have 5 emergency response level that range from level 1, which is the minimum one at the point or the level of the healthcare system, up to the national level, which is level 5. Of course, you are all aware about the basic functions of the incident management system. I will jump directly to the planning section part and talk a little bit about the country experience in that regard. Few words about the org structure of the National Health Emergency Operations Center, where we have 6 main departments or directorates. The first one, which will manage the administrative and the operational affairs. The second one is the operational management department. And the third one is the emergency preparedness department. And we have also the communication, IT, and infrastructure department. And we have also the risk and communication department. And all these will be supported to fulfill the excellence in the emergency management through the Saudi Center of Excellence for Disaster Medicine. When it comes to the operation management here, where the incident management system fits exactly. So,
Dr. Hisham, apologies for interrupting. A few participants are having a hard time seeing the slides. Could you put it on maybe full slide view? I think it's just a little small. We see the slide, but then the next slide and notes. That's possible.
Oh, sorry about that. I assume that you have the full view. Can you confirm now if you can see now the full presentation mode?
Not yet. We still see slides on the left side. I think if you go to slideshow tab.
All right. Okay.
You can press function F5.
Yes.
It will be.
I'll share now the screen.
I think first you need to do escape.
All right.
Yes, to press escape first. Yes, to end the slideshow, and then you resume the slideshow. So press escape, please.
Yeah, that's I did.
Yep, and then you press presentation mode. Or you can click it.
Right.
Yes, this one. No, still.
Oh, okay. So I'm gonna change it into. Now it works. I think.
Perfect.
Yes.
Apologies for interrupting. Thank you very much.
Thank you very much, and sorry for that. Now, so going back to the planning section part, so there are core responsibilities for the planning section within the incident management system. The first part is related to the data management, where it's responsible for the data collection and management, of course, analyzing the data during the epidemiological investigation, and all related activities, all data management related activities. The second part is development and sharing of operation information. That's range from the collation, evaluation, and dissemination of operations and incident information to visualizing all these data. Now, the third responsibility is the event probable evaluation or prediction or long-term and continuous risk assessment. That's another part related to the planning section. Also, the development of the overall response strategy, objectives, and initial action plan. This is another core responsibility for the planning section. Also, the planning section will be responsible of identifying needed technical expertise. And we have here a little bit different approach in the country, in Saudi Arabia. And I'm going to explain that in the next few minutes. And the last one is that the planning section will be responsible, as you know, for mapping the capacity and the functionalities of all resources needed, the deployment and the demobilization process for the emergency response. What you are looking at now is the breakdown of the planning section within the incident management system in the National Health Emergency Operation Center. As you can see, it's divided into three main parts. So we have the planning section chief. And one of the things that we learned, it's very important, especially during COVID pandemic, is to sustain the operation in all functions. That's why the planning section chief will have a deputy and two deputies in order to maintain the planning section operations through the emergency response. On the other hand, we have core units on the planning section, which is the situation unit, the documentation unit, and the resources unit, the mobilization and demobilization unit. These are the core unit that will be activated immediately whenever the planning section being activated within the incident management system. On the other hand, there are additional unit that will be activated as needed. That start by what we call the war room, and I'm going to explain what is that. And we have also what we call the incident assessment team and the technical specialist and experts, or the experts here. I label it with the green because what we have here in Saudi Arabia is the expert. Once they report it to the planning section, they move immediately to report directly to the incident commander and support expertise and advisory aspects related to the emergency response. So let's define all these. As you know, the planning section chief, who will be the one who oversees all the planning section operation. The situation unit is the unit responsible for managing all situation information, providing situation reports, and work on future aspects or projection and forecast of future incidents related to the current event. And they also provide any other data related to the running incident and disseminated to the relevant stakeholder within the context of incident management system. On the other hand, the documentation unit will document the whole process, focusing on all major actions within the action plan. The resources unit, the unit responsible for planning, tracking all the resources used in the emergency response, and the mobilization and demobilization unit will be responsible for ensuring a safe and effective and efficient mobilization and demobilization of all resources needed in the incident management. So the additional units here, the war room. So one of the things that we have here in Saudi Arabia, we have a unit, a special unit we call a war room, that are responsible for fast track action related to the incident management. Those team will focus on the fast track action within the whole action plan to make sure that everything go on track, and it will be activated and deactivated as needed. From COVID-19 response, the war room actually play a great and a key role in the planning section and the incident management system, fulfilling a lot of actions effectively and efficiently. What we have also in Saudi Arabia, what we call the YAT, or the incident assessment team. And one of the things that the incident assessment team will be responsible for is to do the initial assessment of the incident, whether we need to activate fully the incident management system, what are the initial response objective. And those teams are similar to the rapid response team, where they report immediately to the National Health Emergency Operation Center and gather all necessary or preliminary data to support the overall incident response. The technical specialist, or the expert here, they provide advisory support, and as I mentioned earlier, those group will report directly to the incident commander here after they work initially with the planning section. Now, to sustain the operations and we make sure we have a very effective response, the incident assessment team, as you can see, this table include the calendar of the incident assessment team, which will be composed from all the main functions and the relevant directorate from the Ministry of Health. So we have a calendar through the year for all these relevant directorate, and we have a representative from each relevant directorate through the year whenever an incident an extensive incident that require to be assessed in order to decide and put the overall responses strategy. The incident assessment team will be called, and they will report shortly to the National Health Emergency Operations Center through the year with a very detailed plan and very strong leadership engagement. As you can see here, even His Excellency, the Minister, and his deputy is part of this group. And this calendar will also represent the incident management system as well. So everyone will be called as needed based on this calendar, which of course was very effective and very sustainable actually. And we managed to sustain all operations with all function through this approach. When we talk about the planning section, of course, it's very important. We're actually talking about mostly the data part, information. And what we have here is what we call the National Health Emergency Operations Center Operations Room that has 7 core activities that support the data management part that range from establishing a sustained data collection and channel and ensuring the data quality, monitoring the triggers and others. But the most important part is to sustain data collection channel through the year and ensure the quality through different validation and channel. This is a continuous process. However, when the incident management system is activated, so the operation room will support the planning section by providing the necessary information through the relevant unit. Regarding the data management and data collection and the analysis, of course, the technology part is very essential, but if the technology is not there, the system covers. From that point, the operation room to support the planning section, they have more than 25 visual dashboard for operations and analytics. They feed the necessary information to the situation unit as needed. How the data management work for the planning section, the slide shows exactly how the data collection process works in Saudi Arabia, and to avoid duplication and to sustain communication channel through the year. So the primary data sources will feed the data to the 20 regional EOC distributed through the 20 regional directorate. The primary and the secondary data validation will be there, approval, and this will immediately be communicated to the National Health EOC. The overall communication through the country is the responsibility of National Health Emergency Operation Center. This slide shows the importance of the healthcare facilities and the primary data sources in providing very useful data for the planning section and for the overall emergency response. And this is being managed here in Saudi Arabia through what we call the HEPO, which is the Hospital Emergency Planning and Preparedness Unit, or in another word, the EOC of the hospital itself, where all data related to the emergency management cycle will be managed through those units. And of course, it will support the data management part in the planning section to respond to whatever incident it is. When it comes to the development and sharing of operation information, again, the planning section use different approaches to ensure effectiveness and sustainability of providing important data and reports to the other function of the incident management system. For instance, we have different dashboards that demonstrate and present a status of the incident with the functionalities of demonstrating and forecasting a lot of things. That goes hand by hand by some other report that will be shared through other different channels. And also when it comes to forecasting long-term or even intermediate-term issues, so we are adopting the same approach. The technology is important, data visualization is important. However, we have other tools, as I'm going to show in the next couple of slides. What you're looking at on this screen to the left is what we call the Jadida risk matrix dashboard, where we monitor all the potential risks related to different incident for the whole country, and that supports a lot the incident management system and the incident commander to take decisions based on the reports communicated from the planning section. The other dashboards is another. Yes.
Just you have 3 minutes.
Definitely. So we'll jump immediately to the part of developing the objectives. And here, one of the things that Saudi Arabia managed to do in the National Health Emergency Operations Center is to develop whatever forms that will be useful for the team and support the planning part, setting the proper objective to the response. And there are a lot of schools in that matter. However, the message here is that we need to make sure that we have the appropriate templates or forms that is practically useful to the incident management team to respond to these the incident on hand. The same apply to mapping capacity and other functionalities. As you can see here, we use both approaches, using the forms, the manual forms, and we use the same technology to map all needed capacities and decide which needs to be deployed and demobilized as needed. So lastly here, there are few messages we would like to communicate as part of the country experience, that it's very important to have the incident management system. It's very flexible, it's dynamic. Adopting the incident management system will fulfill the all hazards approach, emergency management and response. The planning section is an essential function within the IMS, and that's why it's very important to make sure that you have whatever practical to support the effectiveness and the efficiency of the overall response in this section. And again, the main purpose of emergency response structure is to facilitate. However, innovation is always a useful tool for whatever EOC is there. So be innovative on the incident management system to whatever support your overall operations. The technology at last is important, but you can achieve a lot without the technology. So be innovative in that part. Thank you very much.
Thank you very much, Dr. Hisham, for this great presentation. I think we have learned a lot. As take-home message, we can see how important it is to have predefined structures and systems in place which can be activated when we have emergencies. And we have seen that you have a predefined structure of the within the incident management system for planning section with clearly defined units and sections as well. Also availability of the templates and forms planning is also very crucial. Thank you very much for that. I think without wasting time, let's proceed to the second presentation. And by the end of Côte d'Ivoire's presentation, we are going to take questions from participants. So our second speaker is Dr. Sharif Jibril, who will share experience on the operations section of the incident management system. Dr. Sharif is a medical doctor by profession and holds master's degree in microbiology and epidemiology. He is a member of the African Union Rapid Response Team. He was also trained as trainer by WHO, Africa CDC, and US CDC. He's currently he led the development of the EOC as well as all the plans and procedures available in the EOC to guide the management and operations of the EOC. He is also a senior researcher. Over to you, Dr. Sharif. Are you going to share your screen?
Yeah, if it's possible.
Okay, please share your screen. You will have 15 minutes.
Okay. Okay. Hello.
Yes.
You get the full screen?
No, not yet.
I'm in full screen in my laptop.
Oh, really?
Yes.
We can't see.
If it's difficult here, you can share my presentation for me. Is it okay?
Okay, so give me 1 minute to open your presentation.
Oh, okay.
Wami, can you allow me to share my screen?
Oh, okay. Yeah, it's okay.
Okay. Please proceed.
Yeah, it's okay. So, the presentation, can I do it in French or in English?
Please feel free to present in French. There is a parallel interpretation. So,
Okay.
colleague, please, he will present in French. So if you want to follow in English, there is an interpretation service. You can press on the button interpretation to access the translation service. Over to you, Dr. Sharif.
Ok, thank you. Donc, je vais vous faire la présentation au nom de la Côte d'Ivoire sur l'expérience de la Côte d'Ivoire dans la gestion des urgences. Ouais. Une ça. Je dépends, je peux vous me suivez avec. Donc, il faut dire que les urgences de santé publique constituent une problématique pour toutes les nations dans le cadre de l'atteinte des objectifs de développement durable. Donc, ces menaces sont de divers niveaux et de gravité diverses. Et il faut dire que depuis les 12 dernières années, le monde a connu diverses menaces. En effet, nous avons connu 2 pandémies majeures et diverses épidémies à différentes échelles. Donc, face à ces urgences, donc, il est convenu de mettre en place un système dynamique, flexible et efficace afin de faire face à l'ensemble de ces menaces. Next. Donc, au niveau de la Côte d'Ivoire, nous avons mis en place une structure qui s'articule comme suit. En fait, ici, ce qu'il faut remarquer, c'est qu'il s'agit de la conception générale de notre système de réponse aux urgences et aux épidémies, qui partent depuis les coordinateurs, en passant par le gestionnaire de l'incident. Et nous avons ici une spécificité au niveau des commissions. Au lieu d'en avoir 4, nous, au niveau de la Côte d'Ivoire, nous avons 5 commissions, c'est-à-dire la commission des opérations, la commission planification, la commission logistique, la commission communication et enfin la commission administration et finances. Next. Donc, quelle est notre expérience de la gestion du COVID en Côte d'Ivoire? Il faut dire que dès le mois de décembre, sous la recommandation de l'OMS qui demandait à tous les pays qui disposaient d'un COU d'activer le système de gestion de l'incident, de mettre en place leur système de gestion de l'incident, nous avons au niveau de la Côte d'Ivoire activé notre COU dès le mois de décembre 2019. Une fois que cela fut fait, nous avons très rapidement, avec le support technique des collègues de l'OMS, que nous remercions ici au passage, nous avons élaboré notre plan de gestion de cette maladie-là. Donc, nous avons élaboré le plan de préparation, puis le plan de réponse. Donc, c'est un plan qui s'est chiffré globalement à 96 milliards de francs CFA. Et ensuite, nous avons activé un certain nombre de structures sous le COU, à savoir l'activation du centre d'isolement au niveau de l'aéroport international Félix Houphouët-Boigny. Ensuite, nous avons mis en place un centre de transit et de confinement au niveau de l'Institut national de la jeunesse et des sports. C'est une institution de formation. Donc, cette institution-là a été dégagée pour une période afin que toutes les personnes entrant en Côte d'Ivoire puissent être screenées au niveau de cette institution et puis pouvoir les suivre au cours d'une période de 14 jours avant de les laisser rentrer chez elles. Ensuite, nous avons très rapidement développé les procédures et les thèmes de référence d'un certain nombre de structures, à savoir les EIR et l'équipe de suivi des contacts, ainsi que d'autres structures. Et puis, enfin, nous avons activé les équipes d'intervention rapide pour les investigations des cas. Donc, tout cela nous a permis de très rapidement détecter les premiers cas survenus en Côte d'Ivoire, à savoir le premier cas le 11 mars 2020. Next. Donc, comme je l'ai indiqué tantôt, nous avons activé également et mobilisé les équipes de suivi des cas. Nous avons mis à l'aéroport une cellule pour le contrôle et la recherche des cas suspects par voie aérienne, par voie de port ou par la voie terrestre. Ensuite, nous avons mis en place 13 centres de COVID, c'est-à-dire des centres de prélèvement COVID dans le Grand Abidjan, 13 centres qui étaient sous la responsabilité directe du chef des opérations. Donc, comme je l'ai indiqué tantôt, le premier cas a été confirmé le 11 mars 2020. Next. Donc, après ces généralités, quel a été notre rôle en tant que gestionnaire des opérations dans la gestion du COVID? Donc, ici, nous vous présentons l'organigramme des opérations. Donc, nous dépendons du gestionnaire de l'incident. Ensuite, nous avons le chef des opérations, moi-même, et puis les autres commissions et sinon les autres sous-commissions et les sections au niveau des opérations. Donc, c'est cette structure-là à partir de laquelle nous avons opéré dans le cadre du COVID en Côte d'Ivoire. Next. Donc, quel était le rôle spécifique de chacune de ces structures que je viens de vous présenter? D'abord, le chef des opérations. Son rôle est la coordination de l'ensemble des opérations, c'est-à-dire tout ce qui est action sur le terrain au profit des populations à risque. Ensuite, j'avais également pour rôle de valider et de partager les sites web. Je pense qu'il y a certaines personnes ici sur cette plateforme de communication qui ont reçu divers de nos sites web. Également, comme je l'ai indiqué tantôt, j'avais également pour responsabilité de coordonner les activités au niveau des sites de prélèvement COVID installés au niveau d'Abidjan. Donc, je vais vous faire très rapidement un point. Nous avons installé au début de cette épidémie-là, c'est-à-dire entre mars et avril 2020, 13 sites de prélèvement COVID dans le Grand Abidjan. Et actuellement, nous avons un peu dégraissé ces sites-là. Nous sommes passés de 13 à 10. Et entre le 25 et le 31 janvier, nous pouvons faire un bilan. Il y a eu 13 228 échantillons qui ont été collectés. Et ces sites-là, aujourd'hui, leur activité représente environ 42% de l'ensemble des prélèvements réalisés au niveau de la Côte d'Ivoire. Next. Ensuite, nous avons une autre section qui est la session de prise en charge. Donc, cette session-là a pour rôle d'assurer la prise en charge clinique de l'ensemble des cas ou de coordonner leur prise en charge avec les autres sites de prise en charge, et également l'isolement et le traitement des cas confirmés dans les différents hôpitaux. Et le 3 mars 2000, au 1er mars 2021, nous avons en Côte d'Ivoire enregistré 247 décès, dont 3 décès au 1er mars. Nous avons une létalité qui tourne autour de 0,55%. Mais ces chiffres-là sont en nette augmentation parce que très rapidement, depuis que nous sommes rentrés dans la deuxième vague de cette épidémie-là, la Côte d'Ivoire est davantage touchée avec un nombre important de décès. Ensuite, nous avons la prise en charge psychologique des patients et de leurs familles. Donc, également, c'est une section qui est au niveau de la grande section prise en charge. Donc, elle assure la prise en charge psychologique des cas, c'est-à-dire des cas suspects et des cas confirmés, ainsi que des familles des personnes décédées. Parce qu'il y a des événements dont nous avons été confrontés. En tout cas, je ne sais pas si ailleurs il y a eu les mêmes choses, mais il y a eu des aspects suicidaires, c'est-à-dire les personnes, soit parce qu'elles avaient fait leur prélèvement et étaient en attente de leurs résultats, ces personnes-là étaient très stressées. Et certains même avaient des élans suicidaires. Ou bien des personnes qui sont confirmées positives et qu'on maintenait en confinement. Ce confinement-là avait... OK. Ce confinement-là... OK. 3 minutes. Donc, ce confinement-là avait un effet sur ces personnes-là. Donc, elles avaient besoin d'un suivi psychologique. Next. Également, nous avons la PCI. Elle a pour rôle la formation du personnel de santé en général afin d'éviter les contaminations sur les sites. Également, cette session-là avait en charge la biosécurité, l'évaluation de cette biosécurité-là. Et puis, elle formulait des recommandations dans le cadre de la biosécurité. Il faut dire qu'à ce jour, plus de 4000 personnes, en tout cas les agents de santé, ont été formés à la biosécurité. Next. Également, il y a le personnel de veille qui, eux, font partie de la section épidémiologique. Le rôle de ce personnel-là est la collecte, l'analyse des données sur le COVID, ce qui nous permet de faire les sites REP. Également, ce personnel-là, en dehors du COVID, travaille toujours à collecter, à compiler et à analyser les données sur les autres maladies. C'est-à-dire, au-delà du COVID, le personnel de veille continue son travail de routine en termes d'évaluation de la situation et des menaces, en termes d'investigation des rumeurs et puis de la production du bulletin épidémiologique hebdomadaire. Ici, ce bulletin-là, nous l'appelons le VG. Next. Next. Nous avons une autre section qui est le suivi des contacts. Eux, leur rôle, c'est le listing des contacts des cas confirmés de COVID et puis ils assurent l'encadrement et la collecte d'informations sur les personnes qui sont confirmées et suivre ces personnes-là durant leur confinement de 14 jours. Au niveau du COU, nous avons 6 équipes de 4 personnes qui mènent cette activité-là à côté des équipes des districts. Next. Très rapidement, voici le bilan de l'activité de ces équipes de suivi de contacts. Il faut dire que à ce jour, nous avons suivi jusqu'au 13 mars là 44 744 personnes pour 16 015 cas confirmés. Et il y a sur les 2120 contacts que nous suivons actuellement, nous suivons 1990, soit un taux de suivi d'environ 94%. Next. Également, nous avons la gestion des points d'entrée, toujours au niveau de la sous-commission épidémiologique, qui assure le contrôle des passagers, c'est-à-dire leur statut au niveau des frontières terrestres, au niveau des frontières aériennes et des ports. Ensuite, elle fait le listage de ces personnes lorsqu'elles arrivent, qu'elles présentent des signes ou qu'elles ont une température qui est élevée. Et puis, elle organise avec la structure qui est chargée du transport médicalisé, le transport et le confinement des personnes suspectes au niveau qui entrent en Côte d'Ivoire. Next.
Your time is up, Dr.
Okay.
Could you please summarize? Your time is up.
Okay. Donc, so 1 minute and I'll finish. Donc, il y a également les équipes d'intervention rapide qui, eux, assurent les investigations des alertes et des cas suspects. Également, ils réalisent sur les cas suspects la collecte d'échantillons pour le transfert au laboratoire. Pour ce qui concerne la Côte d'Ivoire, nous avons 159 équipes d'intervention rapide, dont 10 du COU, et puis nous avons une équipe au niveau de l'armée. Je pense que ici, nous pouvons nous arrêter pour ce qui concerne l'expérience de la Côte d'Ivoire, parce qu'après, c'est un peu plus long sur la gestion des cadavres et autres, mais je pense que nous n'aurons pas le temps. Donc, nous allons nous arrêter pour notre présentation sur cette diapo. Je vous remercie.
Thank you very much, Dr. Sharif, for this nice presentation. You took us through the structure under the operations section, which include the different units of case management, IPC, contact tracing, and so on, but most importantly, the rapid response team, like we learned by theory, rapid response team, and also the watch team operates under the operations section, and this is active during all phases of modes of operation in the EOC, from the watch mode to alert and response mode. Thank you very much for this great presentation. Now I turn to Catherine to take us through some of the questions. I see plenty of questions in the Q&A box. Catherine, over to you.
Yes, thank you, Sanaid, and thank you to our presenters. There were a lot of questions, so I will start at the top. And Dr. Hisham, some of these came up during your presentation, so they might be best directed at you at first, but Dr. Sharif, you probably will also have some good insight from Côte d'Ivoire. So the first question, the first two questions I will combine a bit. The participant has asked that you expand a bit on the role and responsibility of the war units and the documentation unit. I know you went through a brief description, but it may be helpful to talk a little bit about how the units have been active, especially in COVID-19. Thank you.
Thank you very much. That's actually one of the important questions. With regard to the war room, the idea came on that during the overall planning for the COVID response and other emergency response. So we've noted that due to the COVID situation and the mandate and the norm of COVID, we need to manage our resources in a way that we sustain the operation, we fulfill the basic response objectives. From that point, some of the high priority action needs to be taken through a smaller group. This small group will focus on facilitating those fast track actions within the overall emergency response action plan. The activities and the actions managed and tracked by the war room is maximally through 72 hours operation period. So all the action that should be covered through the next 72 hours will be handled immediately through this war room to track with whoever responsible from that, provide the necessary support and facilitate whatever challenges faced by whoever responsible from those tasks. It supports us a lot during the initial response of COVID-19, and especially when you deal with multiple incidents at the same time, you will find yourself having a lot of high priority actions that might need to be covered through a specific task force, that's to say the war room. On the other hand, the documentation part is very important. What we have here is we use the what we call the AHOP system or READY system, which is the system used by the National Health Emergency Operations Center. One of the things that we're doing now is whatever being placed as an action plan and all the communications during the emergency response will be documented in the system. That helps in two different aspects. Number one, it's a lesson learned process. Whatever we do and document, there will be a time to review all these action, and we improve in the future when it comes to this dealing with the same incident. Plus, not all regions are dealing with the same incident. And as you probably know, disaster doesn't come all the time. So whoever deal with whatever incident and emergency, this will be documented by region A, for instance, but the documents and the lesson learned from there will be shared with everyone in the country. And that's why the documentation part is very important. I hope I answered the question. Over to you.
Thank you very much. And Dr. Sharif, you know, from your experiences, maybe you can speak a bit to the documentation and report unit that you introduced us to, or any of the challenges that those units have faced as well during COVID-19. Thank you. Dr. Sharif, can you hear us? Looks like his connection might have gone bad. I'll move on to the second question and hope that he's able to rejoin in a moment. The second question was asked by multiple colleagues, and it concerns how information is shared by the EOC with other EOCs, whether they be regional or outside of the public health sector and even the private community. So if you could speak to that, I'd appreciate it. Over to you.
Thank you again for the question. Now, when it comes to information sharing, it's very important to share experiences and information during and after the incidents and emergencies. So what we have here in the National Health Emergency Operations Center, what we call information sharing protocol, which support the confidentiality aspects and the non-disclosure agreement of some of specific informations and data. Having this protocol allows us to expand the maximum information to all entities that range from the private sector, non-MOH governmental sector, and of course the Ministry of Health. So this protocol helps us a lot to manage information and sharing. And again, the technology part play an integral role in that matter, where we manage to have different roles within the AHOP system already, readiness system, so that each role will be already defined to specific views and information that is useful to that specific role, and of course support the overall emergency management. That includes, of course, the regional emergency operation center through the country. Over to you.
Thank you. And Dr. Sharif, apologies, we lost you for a moment. We've just been talking about how the EOC shares information with other either regional EOCs or with other private partners. And I would ask you the same question if you have, first of all, how that's conducted, if you have protocols or even legislation to direct how that information sharing is done. Over to you.
Okay. Oui, merci bien. Oui, puisque nous sommes inscrits dans le réseau
I think he has a problem with the internet connection. Maybe you proceed with next question with Dr. Hisham.
Absolutely. And Osman, feel free also to interrupt if there's a question that you would like to pose as well.
Yes, thank you so much, Dr. Hisham, for this very elaborative presentation, and I hope that we help reconnect with Dr. Sharif. There is some question regarding use of technology. I know that you presented some sort of a technology that, so if you can shed light more on technology using contact tracing for maybe, for example, or other technology that's being used to gather information and to share it with other sectors. That this is some of the parts that it is asking for in this direction. Over to you.
Yeah, thank you once again. Actually, one of the innovative aspects of the overall emergency management in Saudi Arabia is the technology itself. Now, the technology, of course, it support the operation and it support sustainability. How it affects the overall operation. Actually, if we took the case contact tracing as an example, we have our colleagues and partners within the structure of the incident management system in the Public Health Institute, who will fit into the operation arm and work on the elements related to public health interventions, the medical care, and the case contact tracing. For the case contact tracing itself, we use the mobile application as it's more feasible. However, it's directly linked to the same technical solutions we are using in the National Health Emergency Operations Center. Adopting the mobile application as a practice, it allows to expand the contribution not only from the experts within the Ministry of Health, but also the involvement and the engagement of the patient themselves in the experience. And of course, that helps us a lot. Furthermore, on the technology part, it allows even to support complying with public health measure. What we have another mobile application that's integrated together. For instance, if there's no proper distances, or if you've been contacted previously and come along another person, all these type of technologies support us a lot. On the other hand, other type of emergencies apart from COVID-19, for instance, when it comes to mass casualties, the technology also played an integral role in the National Health Emergency Operation Center. For instance, one of the important aspects is the communication part. So to sustain the communication during the emergency response, we adopted what we call the PACE approach, where we have the primary, the alternative, the comprehensive, and the emergency communication line, where we sustain a continuous communication through the different layers of emergency management, from the tactic to the operations to the strategic layer. So yes, the technology helped us a lot, and there is a lot to say in that matter. However, for the sake of time, I think those are two different examples of how the technology support the overall emergency.
Thank you so much, Dr. Hisham, for this. I don't know, Dr. Sharif, can you hear us? Can you speak? No? I think we still have a problem with Dr. Sharif. So for the sake of time, let's go back to... Okay, Sanait, over to you.
It seems he's back. Dr. Sharif, can you hear us? Dr. Sharif, are you there? No, he cannot. Yes. So Osman, maybe you take one more question and we wrap up.
Yes, another question that regarding if there is any legal instrument that is used within the case, say to support, facilitate coordination between other entities, and also regarding information sharing. I remember that you mentioned the protocol for data confidentiality, but if there is any other legal instrument that used to facilitate the coordination between different entities or stakeholders, over to you.
Definitely there. So as legislation, we have what we call the National Emergency Response and Preparedness Framework, where we have a lot of supporting legislative forms and protocols that support the confidentiality and information sharing, and that's expand from the health sector to all related entities or ministries in the context of emergency management. So information sharing protocol and confidentiality of data protocols are all supported legally through the whole country. Over.
Thank you so much. I think now we're running out of time, so back to you, Sanai.
Thank you very much, Osman and Catherine. Back to you if you have any insights from today's presentation, Catherine and Osman.
Just wanted to thank our presenters for very instructive and insightful presentations, and I appreciate them both being with us today. Over from me.
Yes, also I would like to thank both Sharif and Hisham for this excellent presentation. They give us a very holistic approach regarding what we do for the planning and also for the operation, how this could interconnect it with other entities